So again, you can't call a place a specialist hospital unless you have the requisite tertiary radio diagnostic services that are needed. So in addition to that, His Excellency approved for the procurement and supply of radiology equipment such as 4D ultrasound scanning machines, digital x-rays, and so on. And then in the laboratory, all the necessary tests from chemistry, hematology, hormonal assays, and so on were also, made available to them. And then, of course, the training of the lab scientists that are needed to work with the machines, maintain the machine, and so on. In addition to that, His Excellency also established a 250-bed capacity maternal and child health complex here in the center, within the Yobe University Teaching Hospital. The idea of doing that is the fact that maternal and child health issues are very problematic here in the state, and so there was need to actually establish a center where you will have tertiary care training and research that happens, where people can come and provided with such services, where we'll be able to train our healthcare workers, in the various fields of MNCH and so on. We also, His Excellency also, constructed isolation facilities, a 200-bed capacity isolation center here in Damaturu. The reason for it, during the COVID-19 pandemic, we saw, although we had an isolation center, but then we saw the need to actually be prepared, especially with what we have seen, in the other parts of the country as well as abroad. So that was also done. In addition to, of course, putting in place the molecular diagnostic centers in the specialist hospital in Damaturu as well as the one in the teaching hospital. In addition to that, there was need to train manpower within. But that is post when after the undergraduate training on internship. So
I wanted to come to that training of personnel.
Yeah, so that infrastructure was also provided. So a house officer's quarters was a 30-bed house officer. A 30-room house officer's quarters was also constructed. At the undergraduate level, again, because our medical students are about to cross to the clinical side, they need to also, meet up with accreditation requirements. So His Excellency also graciously approved, and we've already completed the construction of a provost office, laboratory complex, and a state-of-the-art lecture theater. There was a 3-star hotel that was initially constructed that was also converted to serve as the clinical site. So that was also renovated. So as it is right now, we have all the infrastructural needs and even the equipments and supplies that are needed to meet up with the accreditation requirements. Through the TED fund and other supports, we're also able to construct hostel accommodation for the medical students. So these are some of the infrastructures that His Excellency has done. There are so many others, but then time will not permit us to, continue to mention all of them. For instance, now in the specialist hospital in Buni, the hospital was renovated, additional MNCH complex and accidents and emergency complexes were actually constructed.
You spoke little on training. I would like you to expatiate. Training of personnel is very, very essential. What is the administration's policy in that aspect?
The policy of this administration basically is to, have indigenous manpower made available. Because the experience is the fact that I think with the nature of and then of course what we have gone through, we find it very difficult to get people from outside to come and, settle and work here. So as such, a system was put in place to train manpower in the different fields of health. We have established, of course, a College of Health Sciences and Technology where the lower cadre manpower are trained, After graduation, they are absorbed and posted to the primary health care facilities, some even to the secondary health care. So there they train the community health extension workers, the pharmacy technicians, lab, HMIs, and so on. And it will be of interest to note that these courses were actually floated in order to meet up with the demands and the desires and needs of the system, not just to float a training program. For the training of nurses, midwives, community nurses, and community midwives, the Shehu Sule College of Nursing and Midwifery was there also enhanced, and strengthened to further train and increase the number of people that are absorbed. That are given admission to study those courses. On the request of the state, courses like the community midwifery and community nursing, because of the peculiarities of the state, were also floated to that. The other thing is that, the government has, since the early 90s, has been sponsoring its indigents to study medicine in universities within and outside the country. In addition to all this, government also saw the need to also train its manpower at the different postgraduate levels. So again, government 100% sponsors its indigents to go for residency training in institutions outside the state. So for instance, as we speak now, we have over 45 to 50 or more of our indigents in the different specialties of medicine. So as it is now, we have the pharmacists, nurses, lab scientists, physiotherapists, and so on, that have actually been engaged on that level. So as soon as they finish school, automatically they are just going to be upgraded and then absorbed back into the system for them to continue working for the system.
All right, let's talk about child and maternal health. It's still a challenge in Nigeria. What is the Yobe State government doing to address this?
Yes, the problem of maternal and neonatal child health is actually, everywhere, but then, previous surveys have actually shown that the Northeast, Northwest tends to have some of the lowest indices. And in that light, government saw the need to actually look at what are the root issues around that and what it can do. So part of it was the problem of access, especially financial access. And that is why, of course, since 2009, successive governments in Yobe State have been operating the free maternal, neonatal, and child health program and accident victims program, where on a monthly basis, monies are released for the procurement and supply of drugs, medical consumables, and so on to the facilities.